at that. We are live. How about that? Welcome to this week's Wellness Webcast. My name is Mo Wolf. I am the CEO of Little Honeys LLC. How about that? We are the makers of your Bee Energized Raw Bee Pollen products and Bee Rescue Focus Care. Mr. Sadler, you look like you're in good shape today. Welcome. Welcome. You know how realtors like to say location? Well, I think more appropriately we should be saying timing. I don't know if you can hear it, but right now, just beyond this barrier to the outside world, you know, there's just a thin piece of glass that keeps me in here and from being out there. And on the other side of that, there are workmen, and they are taking big grinders, and they are working on cleaning up some handrails. And so if you hear a bunch of odd noises in the background, no, that's not borborygmus of Mr. Sadler's stomach. That is the workmen. Big announcement today. Huge announcement. I'm in the Midwest. Huge announcement. That huge announcement is this. I'm stalling and dropping my coaster. The huge announcement this week is this. We have a new driver in the house. Congratulations, Abby Wolf, my little sister. She passed her driver's test today. That's pretty fancy. But even with all of that good news, I have to tell you, I'm a little down today. I'm not just a little down. I'm feeling very down, and I will tell you why. It's because yesterday I went out to the mulberry tree, which is out behind our offices here, and those beautiful mulberries are starting to dry up, and those that are still producing are starting to get smaller, and it's August 2nd, man. The summer is almost gone. Where did it go? I'm gonna miss my mulberries. Gonna miss them a lot. Mr. Sadler's shaking his head. Well, not you too, Julius. Yes, in case you were wondering. I'm firmly ensconced still behind the chair that the desk, which is the flagship of Little Honeys LLC. I've got our official program observer, Mr. Norman Sadler, and we have Julius locked tightly away in the room next door, which is where she should be. At least that's the popular consensus. I'm going to hear about that, I know. This week on the Wellness Webcast, we are going to actually tackle a very difficult issue. It's a difficult issue because there are so many people that are affected by it. According to some studies, there's as many as 19 million Americans right now living with some sort of major depression. And today we're going to talk about depression. Depression, it's just tragically widespread. In my stack of all manner of stuff, there's one estimate is 5% of women are dealing with depression. As much as 10% of men in some cases. These are staggering numbers. but 19 million Americans living with some sort of major depression. We're not going to talk about the bipolar depression where you've got both the depressive times, the troughs, the valleys, and then the peaks, the manic episodes. We're going to talk about just depression, where you get down. I mentioned I was feeling down about summer coming to a close. We're going to talk about where you feel down and you stay down. There's a lot of interesting information out there. One of the things that's frightening, though, is you start feeling down, and you go to your spouse, maybe your friends, they say, you just aren't yourself. You haven't been yourself for some time, a couple of weeks maybe. You're feeling tired all the time. You're just not you. You should go see your doctor. And you go to your doctor, and your doctor talks to you about how you've been feeling, and your doctor decides, I think perhaps you're depressed, so I'm going to write a prescription for you. They hand it to you, and you go out the door and you go to your favorite neighborhood pharmacy and you get it filled and you bring it home and you've got this bottle of pills. Problem is, nothing was done to address the depression. They gave you a bottle of pills. There is widespread controversy and conversation as to how much depression is actually caused by a real imbalance of chemicals in the brain, how much of it is, exogenous, how much of it is reaction to external stressors. Maybe you've been working too hard, maybe you've got some sort of, maybe there was a trauma, maybe you lost a loved one and you just can't seem to get over it. Maybe there's any number of issues, but the bottom line is you're feeling like the udders on a snake and you just can't seem to get past it. Well, let's first talk about the symptoms of depression. According to the Mayo Clinic, in an article published by Mayo Clinic staff, Lurch did not write this one. If you watched last week's episode, you'd know that we occasionally read articles by someone of the name of Lurch. Well, we did last week, and it had a lot of fun with that. And I probably should quit making fun of that individual's name. It was a great article, bang up job. Mayo Clinic. Mayo Clinic says depression is a medical illness that causes a persistent feeling of sadness or loss of interest. Depression can cause physical symptoms too. Depression can lead to a variety of emotional and physical problems. You may have trouble doing normal day-to-day activities, and depression can make you feel as if life isn't worth living. Then they give some of the symptoms of depression. These symptoms may include feelings of sadness or unhappiness, irritability or frustration, even over small matters, loss of interest in pleasure or normal activities, reduced libido, insomnia or excessive sleeping, changes in appetite, agitation or restlessness, irritability or angry outbursts, slowed thinking, indecisiveness, fatigue, tiredness, loss of energy, feelings of worthlessness or guilt. This is just going to keep going on. You get the picture. You get the pattern of the disease. But then this kind of, red flags it for me when you get to the section of their article that says causes. This is what the Mayo Clinic says. It's not exactly known what causes depression. As with many mental illnesses, it appears a variety of factors may be involved. These include biological differences. People with depression appear to have physical changes in their brains. The significance of these changes is still uncertain, but may eventually help pinpoint causes. Neurotransmitters. These naturally occurring brain chemicals linked to mood are thought to play a direct role in depression. Well, that's some of the old science that was done back in the 80s and 90s that they thought might have an issue with neurotransmitters, and that's where we get the whole concept of treating depression with antidepressants. not regulating those neurotransmitters, especially the SSRIs. Hormones. Changes in the body balance of hormones may be involved in causing or triggering depression. Inherent traits. Depression is more common in people whose biological family members also have this condition. Life events. Certain events in someone's life, such as loss of a loved one, financial problems, high stress, early childhood traumas. All of these things working together could cause, or in one by themselves even, could cause some sort of depression. You feeling down? You feeling like the udders on a snake? You feeling tired and loss of energy? Crying spells for no apparent reason? Unexplained physical problems such as backache or headache? Loss of libido? You don't enjoy the things that you once enjoyed? Well, I tell you what. According to a lot of research, you may not want to be going to the doctor and getting that little pill. You might do better with some talk therapy. You might do better going to your alternative medical professional. Yeah. The Lotus Institute of Integrative Medicine, right here. I was looking through their list of symptoms of disease index in their book, and I looked up depression, and lo and behold, they had 12 different types of depression outlined in the Lotus Institute of Integrative Medicine, and it's looking at medicine, looking at the body and pathologies from a traditional Chinese medical standpoint. What's interesting to me is they had 12 different types of depression listed here, and some of the symptoms associated with each. But what's really interesting to me is each one of them had what we call stagnation of some sort of, either stagnation of phlegm, qi, blood, or food. Now, right there, I lost a lot of you Western metaphiles, because you're saying there's no such thing. Well, yeah, there is. No amount of denying it is going to deny the fact that it's really there. Yin in the body refers to all of the fluids, including the blood, the interstitial fluids. This stuff has been shown to be in existence. Maybe it's a little bit esoteric and archaic definition for you, and a little bit esoteric, even archaic nomenclature, but tough, it's still there. So when these things aren't moving in the body as they're supposed to be, according to the Lotus Institute, you've got depression. Well, acupuncture is very good at moving qi and blood, again using that archaic language. Western medical terms, acupuncture is very good at helping to stimulate and even regulate hormone production and that communication of one part of the body to the other. So that's one option. Herbal therapies. But something I want to throw by you here. One significant danger of psychotropic drugs is that, and this includes all of the drugs used to treat the depression, including all the antidepressants, is that they can upset the delicate processes within your brain needed to maintain your biological functions. This risk simply cannot be overstated. The documented evidence cites that there's some staggering statistics. I can't talk today, Miss Tadler. I think my tongue is on vacation or needs a vacation. Or just a date with a really good steak. I just lost more viewers. The vegetarians all hung up on me. Oh well. We didn't need you anyway. Gonna throw me into a depressive episode. Think of my poor parents when I was born. True story. When I was born, my mother and father both looked at each other and said, "No mo, no mo." It's true! Julius, you can bear me out on that. Anyway, The documented evidence cites that there are some 700,000 adverse reactions per year to psychotropic drugs. There are some 42,000 deaths associated with these drugs per year. And yet, you're feeling down, can't seem to pull yourself out of it, under a lot of stress, and you're feeling lousy. Maybe you lost someone that you dearly love, and you just can't get past it. We're going to give you a pill for that. What's wrong with our society? We get a hangnail, and there's a pill for that. Our heart starts shutting down, and we can't get off the sofa because we're just so lethargic. There's a pill for that. But wait a minute. We've lost the art of medicine in this country. We've excelled at the science of medicine. But we've lost the art of medicine. We've lost the art of looking at the whole body and looking at the individual and trying to pinpoint root causes. We've gone to treating symptoms with science, which is very impressive, and I'm thankful for it. But for land of Goshen, whatever happened to treating the patient? Whatever happened to, so you feel lethargic, you don't want to get out of bed in the morning, you have feelings of worthlessness, you just are having a hard time. Let's see if we can find out what's going on in the body. In the meantime, while we're working on this, let's make sure that you're getting some talk therapy. Let's make sure that you're getting plenty of exercise. Let's look at your diet. Let's see if we can get you hooked up with somebody that can give you acupuncture. Let's talk about bee pollen. So there's that nutritive aspect of depression again. But no, we just throw a pill at them. Now I'm getting on rants, I know, and I don't want you who might be watching this that are having difficulties with depression, struggling with depression, and on medications. I don't want you feeling guilty, and I don't want you self-medicating and taking yourselves off, because that's dangerous. That's dangerous and that's foolish to take yourself off of your medication willy-nilly. If you want to get off your medications, talk to your doctor. See if they can work with you on that, cutting things back. But if you have a good doctor, he's not going to let you do that unless you've got a plan, an action plan that you are keeping in place of alternate therapies to pick up the slack. Chinese medicine has done very well with herbal therapy on depressions. Eating your bee pollen. This is a very interesting article. Well, this doctor here, where did he say that? This particular doctor here said that, Dr. Mercola said that supporting optimum brain function with essential oils is the single most important nutrient in battling depression, and that's omega-3 fatty acids. Dr. Mercola said omega-3 fatty acids are the single most important nutrient-based tool in battling depression. Well, guess what? Let me read something to you. This came from www.secretsoflongevityinhumans.com. And they're talking about bee pollen, and I've verified this information in several other sources. Seems to hold true. Number one, the nutritive function, the nutritive makeup of pollen. It's an alkaline food, which is great for pH issues. 25 to 40% of the vegetarian complete protein in pre-digested free amino acid forms. That's awesome. A variety of fatty acids, including 70% of these fatty acids, are omega-3 ALA. 3 to 4% is the omega-6, and 16 to 17% is monosaturated and saturated fat. These are natural, good sources of nutrients found in bee pollen, and I'd shake mine here, but I ran out. I ate it all. And I haven't filled it yet. Not only does bee pollen contain these omega-3 fatty acids and omega-6 fatty acids, not only does it contain so much protein, but it also contains all, do you hear me? All of the B vitamins. It contains vitamin C, vitamin D, which is rare in plants, and which is very important for combating depression and lethargy. Feeling run down, you need some vitamin D, go sit in the sun for a little bit. We talked about that last week when we talked about skin cancers and the importance of vitamin D. Vitamin D is awesome for helping immune system. It's just a wonderful nutrient. Well, pollen has got vitamin D, it's got vitamin E, vitamin K, up to 60 major and minor minerals, nucleic acids such as RNA and DNA, steroidal and hormonal substances, in other words, substances that will be anti-inflammatory to the body. One of the things that folks with depression often struggle with is unexplained aches and pains in the body, fibromyalgia type symptoms. Well, if you are taking a food that's rich in anti-inflammatories such as bee pollen, remember, Hippocrates used to prescribe it for arthritis, and that's because of these anti-inflammatory properties. In bee pollen, bee-energized raw bee pollen is good stuff. I recommend it. So, right there, we talked about acupuncture, herbs, we talked about pollen. These are all three wonderful tools in the battle against depression. But there's another bit of information that I want to read to you. And this isn't it. Where'd it go? There is a Harvard study. Here it is, right here. My stack of stuff is getting spread out. There's a Harvard study that discusses the fact that there are numerous different options out there for depression. And these folks actually did a study, the effects of Qigong on depression. For the YouTube video, make a note, Julius, for the YouTube video, I'd like to get the link embedded in the video, so that way when folks look at this video, they see the Qigong topic come up, they can go directly to the video that discusses Qigong. Little housekeeping there, sorry. This Harvard study showed that sample sizes in these different studies that they were compiling ranged from 50 to 162 subjects. They studied population varied, with 2 studies conducted on geriatric patients with depression. Other study populations included patients with fibromyalgia, hypertension, Parkinson's, cancer, burnout, severe chronic pain, and female college students. No comments from the peanut gallery. Of course some college grad students are going to do a study on college student females. That's what they do at that age, I guess. I don't know, I was too much of a stick in the mud. I still thought girls had cooties. So wonder that my wife married me. I'm such a nerd. See, I no longer have a pocket protector though. I still keep my pen. That poor woman. She puts up with a lot. Anyway, Harvard study showing that, they went through, I don't know, they went through about over a dozen studies here, and what they found was doing Qigong exercises lowered the symptoms of depression, lowered the symptoms of fibromyalgia, lowered the pain scores associated with fibromyalgia, lowered anxiety levels, lowered depression status inventory numbers in female college students, increased self-esteem numbers on the self-esteem inventory for that same group, lowered depression in the geriatric patients. This exercise that we talked about, I'm not doing the hula. This is that exercise in breathing that we talked about a few weeks back. Simple exercises that help move, in Chinese terms, qi and blood within the body. In Western sense, help increase vasodilation, help regulate and release hormones and help the body communicate with itself. Patients with essential hypertension saw a decrease in blood pressures. Geriatric depression, again, in geriatric patients, a sample of 86 different patients saw a decrease in that depression rate. Patients with Parkinson's disease, not only did they see a decrease in the Parkinson's symptoms, but they also saw a decrease in the depression associated with Parkinson's. And the conclusion by these Harvard folks, Harvard students, was Qigong is a promising treatment with possible effects on motor as well as non-motor symptoms. Don't need a pill for that. Don't need a prescription for that. All that you need to do is exercise that frontal lobe, that willpower section of your brain, and get up and go do the exercise. We talked about the nutrients of bee pollen. All that you need to do is go over, take your bee pollen, and eat it. You know, I had someone contact me the other day asking me about pollen, that if it was still good, and they read me the expiration date. We bottled that pollen 5 years ago, and they're wondering now if it's still okay. If they bought pollen 5 years ago, they're not eating it. They're not using it. Why is it that we have all these tools available to us and we don't use them? Because it's so much easier to get a pill, isn't it? But the problem is these pills that we're taking, one study showed that the pills that we're taking for depression increase our risk of cardiovascular disease. You've watched television, you've seen the advertisements for all of these different antidepressants. They show the cartoon character moping along, and then all of a sudden the character's happy with his shadow chasing, or they'll show someone looking really sad, and it's filmed in grayscale, and then all of a sudden they're on their pill and they're happy and doing things. But there's always that voice at the end that says, and they've got all these symptoms that they're listing out really fast. If you're having any of these symptoms, or if you're feeling suicidal, go see your doctor. Wait a minute. Suicide is a side effect? Increased risk of suicide? Wait a minute. Heart disease? Diabetes? I don't want that. I just want to feel better. Well, number one, if you're feeling any of these symptoms, talk to your doctor. Talk to your healthcare professional. Work out a plan that you both agree with. Number two, if you're already on these medications, don't take yourself off willy-nilly, because that's going to increase your risk of a really bad depressive episode, and even increase your risk of suicide. So work with your healthcare practitioner that prescribed it in the first place. And if you've got a doctor that doesn't want to work with you, fire him. Find a new doctor. A couple weeks ago, I went with my dad to a new doctor. He had that episode where he went to the hospital with a bad reaction to one of his blood pressure medications, and we decided it was time to find a new doctor. So we found a new doctor, and I went with him, and we're sitting there in the guy's office. First thing the guy does is he comes in and he shakes hands with Dad and introduces himself. Has Dad start telling him what's going on. The guy's washing his hands, and he goes over, and then what does he do? He put his hands on my dad. He wasn't sitting in front of his keyboard typing up, yes, tell me more, tell me about digital watches. No, he wasn't doing any of that. He had his hands on my dad. He had his stethoscope in his ears, listening to Dad's heart. He even went so far as to start taking distal pulses on Dad's feet. This is a doctor who can listen. This is a doctor who's actually interested in his patient. If your doctor can never pry him or herself away from the keyboard, there's a problem. They you probably have lost the art of medicine. So if you're battling depression, number one, I want you to know that it's a real battle. No one is saying that your battle is not real. It's real, and it's a hard one. Number two, if your doctor can't listen to you or won't listen to you, find a new one. Vaya con Dios, doc. I'm going to go for somebody that practices the art of medicine. Number three, don't get sucked into you need a pill for this. Study your options. Find out. Study for yourself. Don't even just take my word for it. Study. And then, when it's all said and done, make sure that you've got a plan of action that you and your doctor or your healthcare professional that you choose can follow. And make sure that your family is aware of it so that way they can work with you and with your doctor to say, hey, this is working great. Or perhaps they need to say, hey, this ain't working out. We got to change our course. There's so much more that I wish I could talk about. Look at this. Huge stack of stuff yet. There's a lot that we got to do, but we are way over time. We will come back and we will revisit this issue in the future. But until then, consider the things that we've talked about. Consider these alternatives. Be eating your bee pollen, adding it to your diet. You need that nutrition. Be exercising. Start doing your Qigong. Follow the link that's on the video here, and we will get you some Qigong exercises that you can do that will help you. And know that you're not alone. On behalf of all of us here at Little Honeys, the makers of Bee Rescued Propolis Care, I'm getting our own brand names mixed up. I'm tired. On behalf of us, all of us here, thank you for watching. Be well.